Princey, Associate Professor Mental Health Nursing. Today I'll be dealing with another childhood disorder which is termed as the tic disorder. So what is this tic disorder? It is a repetitive kind of a behavior that the child will develop during the developmental period of time. So let us see more about this condition. What is the definition of the tic? Okay, tics are nothing but it is the sudden, rapid, recurrent, non-rhythmic, stereotyped motor movements or the vocalization. So it is the condition which happens suddenly, which is repetitive, which is recurrently happening, and which is non-rhythmic and stereotyped. Again and again, the person will do the same thing in terms of the movement or in terms of vocalization. Okay, so that is termed as the tic. If you take the types of the tic, mainly the tic disorder or the tics are being classified into two. One is the motor tics, the second one is the vocal tics. Again, these motor tics and the vocal tics are subclassified as simple motor tics, simple vocal tics. We have got the complex motor tics as well as the complex vocal tics. According to the DSM-4 classification, tic disorders are otherwise termed as the Tourette syndrome. So, if the child is having a problem with this kind of a tic disorder for a chronic period of time, it is termed as the Tourette syndrome. So, that is the first classification under the DSM-4 classification. The second type is chronic motor or vocal tic disorder. Then we have the transient tic disorder. The fourth one is tic disorder not otherwise specified. So let us see about each of these types. The first one is the Tourette's disorder. What is the diagnostic criteria for the Tourette's disorder? Number one, there should be multiple motor tic and one or more vocal tic. Not necessary that it is concurrently occurring. There should be more motor tics, that is the multiple motor tics, and also there may be one or more vocal tic. The tic should occur every day, almost every day, intermittently throughout a period of more than an year, and during this more than a year period there should not be any kind of a tic-free period for more than 3 consecutive months. So then you can diagnose it as the Tourette's disorder. So what is the onset of this condition? So usually the onset is before 18 years of age. The disorder should not be because of any influence of a substance or any kind of a medication or any other medical condition such as Huntington's chorea, or because of the post-viral encephalitis. So it is found that 4 or 5 people of every 10,000 population suffer from this condition. The onset of the motor tic is usually 7 years and the vocal tics is after 11 years of age. More frequently seen in the boys compared to the girls. So what is the etiology for the Tourette's disorder? We have got the genetic factors which can contribute, which runs in the family. We have got the neurochemical changes as well as the neurobiological or the neurostructural factors and immunological factors. The first one is a genetic factor. It is noted that more common in the twins. 50% of the patients with the Tourette's condition also have got the ADHD condition. 40% of the Tourette's disorder have got the OCD, and also the first degree relatives who are having the history of the tic in the family are at risk of developing the tic disorders in their lifetime. The second one is the neurochemical and neurostructural changes. So it is found that the person with the Tourette's disorder have got abnormalities in the dopamine receptors or the dopaminergic system. There is also an imbalance in the acetylcholine levels. What are the structural abnormalities can be noted as there will be lesions in the basal ganglia which can lead to the movement disorder or this tics. So that is about the neurochemical and neurostructural theory. The third one which we have is the immunological factor. So people who have got this streptococcal infection, so autoimmunity which is secondary to the streptococcus infection can also predispose the child to develop the Tourette's disorder. Moving on to the clinical features. So initially if you take the tics, it's seen in the face and the neck region which will later on progress down. So the first thing that you can notice is the movements of the facial muscles, that you can notice movement in the neck later on which progresses to the whole body. So most commonly, it is going to affect the face, the head, arms, hands, as well as the lower extremities. So you can see the initial symptom, which is the rapid eye blinking, followed by the head tic as well as the facial grimace. You can see that the complex tics will develop later on in the life. What are the prodromal symptoms? You can notice that the child will be very much irritable, will have difficulties in paying attention, poor frustration tolerance, similar to that of the ADHD condition. What is the treatment for this condition? The first thing, you should not misinterpret tic disorders to a behavioral symptom. Okay, tic disorder is different, behavioral problem is different. So you need to clearly identify if the child is having a tic disorder or a behavioral symptom. The next is the family psychoeducation. You need to give an education to the family, counseling to the family, that this condition can be treated. If it is a mild case, then no treatment is required. If it is a severe form of the condition, then we can use the psychopharmacological agents as well as the behavioral modification technique. So if you take the psychopharmacology, most commonly used drugs are haloperidol, pimozide, as well as we use the risperidone or olanzapine group of drugs. Several studies also found that the drug clonidine can also be very much effectively used in case of the Tourette's disorder. If the condition is associated with the OCD, then you can also give the SSRI group of drugs. So if the child is having associated ADHD condition, then you can also administer methylphenidate group of drugs. Moving on to the second treatment, which is the behavioral therapy. So you will be teaching the habit reversal technique. So this is the habit which is being learned by the child. So you're going to reverse this habit by teaching some techniques. So if the child is having a stress as a cause, psychosocial stress is as a cause for a child disorder, you're going to reduce the stress of the child by involving the child in various relaxation therapies. Okay, so that is the behavioral therapy that you will be giving. So this is about the first condition, which is the Tourette's disorder. Moving on to the chronic tic disorder. So this is also similar to that of a Tourette's disorder, which is usually seen every day, almost every day, or it can be seen in an intermittent period. But for it should run for a consecutive period of more than a year, and no tick free period should be there for more than 3 consecutive months. And also it should not have an influence because of the use of any other medications or substance abuse or any other medical conditions. And also see to it, the criteria of Tourette's disorder is not met to be diagnosed as a chronic motor or vocal disorder. What is the prevalence? So this is 100 to 1000 times more common than the Tourette's disorder. So the cause is similar to that of the Tourette's disorder. We have got the influence of the hereditary. So you can note that the motor tics are more compared to the vocal tics. So there will be grunting sound that you can hear in terms of the abdominal muscles, in terms of respiratory muscles. Again, the management is here the psychotherapy as well as the pharmacology. The third condition is a transient tic disorder. So in this, you can note a single or multiple motor or vocal tics. So here the tic disorders or tic symptoms can be noted almost every day for a period consecutively of at least 4 weeks, but not longer than 12 consecutive months. So you can diagnose the condition, and usually seen before the child attains 18 years of age. It should not be because of any kind of physiological effect or any general medical condition or use of a substance or medication. The criteria should not meet the Tourette's disorder or a chronic motor or the vocal tic condition. What is the prevalence? It is seen that about 5 to 24% of school-going children develop this, transient tic disorder. Usually it is exacerbated by stress and anxiety. There is a good prognosis because it is self-limiting. Okay, so that is about the transient tic disorder. Moving on to the last one, which is tic disorder not otherwise specified. So this criteria is for those condition which does not meet the criteria of other tic disorders. Here the tics will be lasting for less than 4 weeks, and usually the age of onset is before 18 years. So this is the various types of the tic disorder. So usually if you take the simple motor tics, there will be high blinking, shrugging of shoulders which will happen. There will be grimacing, tongue protrusion. So all these are the simple motor tics. So if you take the complex motor tics, It includes the various facial gestures, stamping, jumping, eating self, squatting, trilling, echokinesis, and obscene acts. Okay, so coprolalia, copropraxia. Okay, so all those things are there in the complex motor tics. And if you take the vocal tics, we have got the simple vocal tics such as coughing, barking, throat clearing, sniffing, as well as clicking. And the complex vocal tic includes echolalia, palilalia, coprolalia, as well as the mental coprolalia. So these are the complex vocal tics. So if you take the tic disorder, mainly we have got the motor tics and the vocal tics, again the simple and the complex. So these can be treated, okay, when it is identified in the earlier stages by the parents as well as the teachers in the school, wherein which should not become a problem later on in the life of the child. Hope you all have understood the topic. Thank you.